Hello, and welcome to Brown County's 2017 Employee Benefit Presentation. We will be going over your benefit options for 2017. This will include talking about annual enrollment and what can be done during this time. We will give you an overview of all of your benefits and point out any changes that will be effective in 2017. The benefits include the medical plan, the health reimbursement account, as well as the dental, disability, and flexible spending account options. We are currently in open enrollment. What we would ask you do during this time is analyze the benefits that you have available to you and make sure that you have the coverages in place that you want for 2017. Make sure that you're also covering the dependents that you want on each benefit. Now is the time to make any changes. If you do not make changes during open enrollment, you will only be able to do so during the year if you experience a life-qualifying event. This would be a major life event such as marriage, divorce, death, birth of a child, or loss of employment. The deadline for enrollment is December 2nd, 2016. Please refer to your 2017 enrollment instruction packet for more details. This slide will explain the changes that you will see in your benefit offerings for 2017. There will be no employer contribution to your health reimbursement account in 2017. You can continue to use any dollars that are left in this account, and they can be used for all 2013-D eligible expenses. If you terminate employment with Brown County for any reason, you will have 90 days to submit claims for services that have been rendered prior to your termination date. After 90 days, any unused balances will be returned to the county's general health and dental fund. Employees who retire from the county will continue to have 2 years to spend down any unused balance. Wellness incentive dollars will also be eliminated. These are additional dollars that were added to your account for exhibiting healthy behaviors such as getting your annual exams and dental cleanings. The rollover dollars from the health reimbursement account to the VEBA will stop in 2018, but employees with balances will still have access to this account. Employees with balances will be responsible for paying the monthly administration fee for this account, which is $9 per month and will automatically be deducted from the account balance. One more change that is being made in 2017 is to the long-term disability benefit. This benefit will be reduced to 60% of your monthly salary up to $5,000 and will end at your Social Security normal retirement age. Your medical plan for 2017 is not changing. It is still being administered by UMR. You have a $2,000 deductible for a single and a $4,000 deductible for a family. If you're on the plan with any dependents, each person will cap at their $2,000 deductible, and a combination of all family members will track towards the $4,000 deductible. We introduced the premium designation plan in 2015, and that will continue to be in place for 2017. We will discuss how to determine what tier the providers fall in later in this presentation. If you see a Tier 1 provider after your deductible has been satisfied, charges will be paid at 90%, and you would be responsible for 10%. If you see a Tier 2 provider, charges will be paid at 80%, and you would be responsible for 20%. Office visits with the Tier 1 provider will have a $15 copay and then be covered at 100%. Office visits with the Tier 2 provider will have a $30 copay and then be covered at 80%. All primary care providers will be considered Tier 1 as they have been for the past 2 years. Routine services are covered at 100%. We encourage people to go in and get their annual physicals. We would rather have you catch a condition early versus waiting until symptoms are present and it turns into a catastrophic event. Your prescription drug benefit has not changed. You will pay either 20%, 25%, or 35%, depending on what level your drug falls into. You currently have Optum as your pharmacy benefit manager. That will be changing in 2017, and I will give you more information on the transition in the next slide. As you're paying these percentages, they're tracking towards separate out-of-pocket maximums of $1,500 for a single and $3,000 for a family. Once you've met these out-of-pocket amounts, the remainder of the year, your prescriptions will be paid in full. As I mentioned, your pharmacy benefit manager will be changing in 2017 from Optum Rx to to Express Scripts. This will happen on February 1st, 2017. This change will not impact the pharmacies you use to fill your prescriptions. Your pharmacy information is located on the UMR ID card. You'll be receiving new ID cards prior to February 1st, but until that time, continue to use your current card. More information on this transition will be forthcoming. The percentage of the premium that you'll be responsible for paying in 2017 will be determined by your personal health assessment results. As you can see on the slide, depending on the category you fall into based on your points, your percentage will vary. These will range from 11% in the gold category up to 25% for those that have chosen not to participate in the personal health assessment. As I mentioned earlier, we will continue to have the Doctor Tiering Designation Program in 2017. As I mentioned earlier, we will continue to have the Doctor Tiering Designation Program in 2017. Brown County will continue to offer a plan design that encourages members to select physicians with the Tier 1 premium designation. The Premium Designation Program provides you with information and allows members access to providers that have been evaluated to meet certain cost and quality measurements. The Brown County Plan will allow all primary care providers at the Tier 1 benefits level for 2017. These include family medicine, internal medicine, obstetrics, gynecology, and pediatrics. Because this is specific to Brown County, not all the PCPs will be marked as Tier 1 on the Choice Plus provider search site, but will be processed as such when the claims are received. The Premium Designation Program will go through a transition in 2017 from knowing physicians as a Tier 1 to premium care. Therefore, at some point, you may begin to see the designation with the 2 blue hearts rather than the Tier 1 logo. When you review providers on the Choice Plus provider search site, you may see a variety of designations because providers can be evaluated at various levels within the Premium Designation Program. To access the highest level of benefits, you should look for the providers with the Tier 1 designation or 2 blue hearts. Overall results have shown that costs are 16% lower between a premium care physician and a non-premium care physician. The physician specialties included in the Premium Designation Program account for about 80% of the charges for medical claims. The specialty groups have been reclassified, but there have been no charges to the specialty groups themselves. However, ophthalmologists will be removed from the program January 4th, 2017. Members enrolled in the Brown County Plan can register on the UMR site at umr.com to find a provider or view their claims. UMR keeps the past 15 months' worth of claims online. Therefore, you can locate a copy of the explanation of benefits if you need one. Members can also see where they're meeting their deductibles or out-of-pocket amounts, review general benefits information, and access other health-related tools. The website is available on a personal computer, tablet, and smartphone so that you have all this information at your fingertips whenever you need it. If you're enrolled in the medical plan, you can click on the Find a Provider link and it will take you right to the United Healthcare Choice Plus network to locate providers. If you're not yet enrolled in the plan, you can locate providers on the UMR site at umr.com. Click on the Find a Provider link, then scroll down to the letter U and select the United Healthcare Choice Plus network. The Choice Plus provider search site groups providers by the type to allow you to quickly locate providers in your area. You can search for providers within a certain mile radius around your selected location, by name, by specialty, or by condition. Click on the Change Location link and you can search for providers near an address, city, state, or zip code. When searching for physicians, you can locate them by their specialty or by clinic names. The search results will show the Tier 1 providers first and also provide information about the relative cost when available, compared to the other providers within the area. You can filter your results to select the items that are important to you, such as whether the provider is accepting new patients or by the languages they speak. You can also print the results of your search. While the provider contracts don't change frequently, it's always a good practice to double-check your provider status before making your appointment. The UMR member site also provides you with information that allows you to compare the cost of providers in your area. There can be a big difference in the cost of certain procedures, and it's helpful to have a way to compare providers. As an example, the cost for an MRI for the abdomen can range in price from $1,600 up to $4,000 in the Green Bay area. In addition, if you broaden your search, you can choose to use a Smart Choice MRI in Appleton, which would cost $600. The Health Cost Estimator tool is a valuable resource that can help you stretch your healthcare dollars. The Cost Estimator allows you to compare simple services like an office visit and more complex procedures such as a knee replacement and factors in your plan design. I just want to take a moment to remind you of the primary way that UMR communicates with you is through the explanation of benefits, or EOB. Each time they receive a claim, they will generate an EOB. The EOB will tell you what they know about the claim, who the patient was, who the provider is, the date of service, and provide a general description of the service and the amount that was billed. If they have everything they need to process the claim, the EOB will also tell you how much was related to the provider discount, applied to your deductible or copay, how much was paid by the plan, and how much you may owe the provider. If there's an amount that cannot be paid, there will be a note in the notes section. In this example, it's a provider discount. If they need information from you or the provider before they can process a claim, there will be a note in the notes section. If they need something from you to process a claim, you'll be provided instructions of what is needed and how to contact them. The most common reason that the claims may be denied is because they need to know if a dependent on your plan has other insurance. The Brown County plan has a coordination of benefits provision to assure that the plan pays when it should. For example, if your spouse is covered under your medical plan but also has coverage through their employer plan should pay primary and Brown County plan will pay secondary. The main way that UMR obtains this information is from you, and they need to collect it each year because circumstances do change. You can also let UMR know in advance if your dependents have other insurance on the UMR member portal or by calling us. This will prevent claims from being denied to collect this information and will allow them to flow more freely through the system. It is important to provide any information in a timely manner. If you have claims for a dependent that have not yet been paid, log on to umr.com to review the related EOBs and to see if they need any additional information from you before paying any outstanding medical bills. Just a reminder that you can pull up your ID card on your smartphone by using the UMR member portal. That way, you'll always have this information handy. This is great for any adult children you may have on the medical plan. They can register on the UMR member portal and have access to the same tools. Chances are they don't have the ID card in their pocket, but they probably have a smartphone. As in prior years, you'll have the opportunity to put money into an account on a pre-tax basis to help offset out-of-pocket expenses for medical, dental, and vision expenses. You determine the amount you want to contribute, and this amount is taken equally from each paycheck throughout the year. You do have access to these dollars right away on January 1st. The maximum that you can contribute has been increased in 2017 to $2,600, and any unused balances of $500 and below will roll over to the next calendar year. These dollars can be used for 213D eligible expenses. This is a benefit that all should consider contributing to in 2017, as the health reimbursement account is not being funded for 2017. You can also contribute your money into a pre-tax dependent care account. These dollars can be used to help offset expenses for dependents in a licensed daycare facility. The maximum that you can contribute to this account is $5,000. The dependent care dollars are not available until they've been contributed into your account with each payroll. Your dental plan options for 2017 are not changing. You have two options to choose from. The Delta Dental option allows you freedom to choose your providers. If you see a provider that is in the Delta PPO or Premier Network, it will stretch your dollars further. You also have the option of the Care Plus plan. This is a more restrictive plan, as you need to see a dental associates provider in order for there to be coverage. During open enrollment, you can choose to move between plans. So if you're on the Care Plus plan and would like to move to the Delta Dental plan or the other way around, you can do so during this time. There are no changes to the short-term disability benefit for 2017. This benefit supplements your income if you're to be off of work due to a non-work-related injury or illness. The benefit that is payable in 2017 will be 50% of your weekly wages. If you are off due to an accident, that benefit will pay on the first day off of work. If it is due to a sickness, you'll need to be off for 7 consecutive calendar days, and the benefit will start to pay on the 8th day. This benefit will pay for up to 180 days. If you're still unable to work after the 180 days, your long-term disability benefit will kick in and pay you 60% of your wages up to a maximum of $5,000 per month. If the condition that you have does not allow you to return to work, this benefit will continue to pay until Social Security normal retirement age. Your vision benefit with iMed is not changing for 2017. During open enrollment, you can choose to elect this benefit, or you can terminate the coverage if you no longer need this benefit. This benefit helps to pay for eye exams, as well as lenses every 12 months and frames every 24 months. You also have the option of purchasing voluntary critical illness and accident protection. These plans will see no changes for 2017. We hope you found this presentation helpful. Thank you for watching Brown County's 2017 Employee Benefit Presentation.